Hello everyone, I'm Dr. Ye. Today I'd like to discuss the risk factors of kidney cancer, or the renal cell carcinoma, is short for RCC. The number one risk factor is smoking. Smoking increases the risk of developing renal cell carcinoma, and the increased risk seems to be related to how much you smoke. The risk drops if you stop smoking, but it takes many years to get the risk level of someone who never smoked. The second risk factor is obesity. People who are overweight may have a higher risk of developing the RCC. Obesity may cause changes in some certain hormones that can lead to RCC. The third factor is high blood pressure. The risk of kidney cancer is higher in people who with high blood pressure, and this kind of risk does not seem to be low, even if someone who take medicine to treat his high blood pressure. And next is family history. People with a strong family history may have a higher risk of developing renal cell carcinoma. This risk is highest for people who have a brother or sister with this kind of cancer, including the renal cell carcinoma. But there is still some problem because it's not very clear whether this is due to the shared gene or something that they were exposed to the same environment, or maybe both. And next is workplace exposures. Many studies have shown that workplace exposure to certain substances may increase the risk of renal cell carcinoma. And next is gender. Renal cell carcinoma is about twice as common in men as in women. But we all know that men are more likely to smoke and more likely to be exposed to some certain cancer-causing chemicals at work. So which may account for the same difference. And next is taking certain medicines. Some people take medicines for a long time. Some studies have shown that a very common pain medicine, acetaminophen, may be linked to the increase in the risk of renal cell carcinoma. And next is advanced kidney disease. People with the advanced kidney disease, especially needing dialysis, have a higher risk of renal cell carcinoma. Dialysis is a kind of treatment that removes the toxin from your body if your kidneys don't work properly. And next is genetic and hereditary. Some people inherit genes that may increase the chance of developing some certain type of cancer, including the renal cell carcinoma. The DNA in each of the cells that you get from your parents may be changed that give you this kind of risk. Some rare inherited conditions can cause kidney cancer. For example, the VHL gene, if this gene have some problem, it can lead to the clean cell RCC. And the MET gene can lead to the papillary RCC. So someone who have a certain gene mutation, it's good for him to do some imaging tests like a CT scan in some time. Okay, the last questions. If someone who have one risk factor or more than one, does he necessarily get the disease or the kidney cancer? The answer is no. Having a risk factor or several risk factors does not mean that you will get the disease, including the kidney cancer. Even if a person who gets the kidney cancer and he had a risk factor or several risk factors, it's also very hard to know how much the risk factor or factors contribute to his cancer. Okay, this is the end. If you have further questions, please leave a message. Thank you.